Bam! What up, Yang Gang? Welcome back. We're up for another news article with the Trickle up, and of course we got Matt in the bottom right corner, and with Mute the Media from TikTok, and we have Michael to my left, your right, from Resist for Humanity, and of course Mia down here below, the usual suspects. So what do you got for us today on the low, Mia?
Today, we're going to be discussing the CDC studying breakthrough COVID cases among people already vaccinated. And by breakthrough, we mean infections that break through the vaccine's protection. And it's basically sometimes incomplete protection occurs to some extent with a vaccine against any disease. So these are the cases that are doing that.
Well, let's remember the statistics, people. Let's do the math. The most effective one was 95%. That means there's 5% of people. I could be one of them, right? I got my vaccine shot in January. It could have been ineffective. It's just every vaccine's like that. And the second biggest factor to me is the variants. We have no idea if it protects against the variants. It might buffer, it might slow down, but not protect. And we don't know if we can be. I had my vaccine. I could be a carrier of the variant too. I just don't know. We don't know yet.
That's right.
So that's why we got a lot of breakthrough, if you will, scenarios going to come up more and more as people get vaccinated. So we didn't have this problem before because nobody's getting vaccinated.
There's the same problem in a way, though, right? Because earlier with the asymptomatic rate, there's that like unknown factor. Mm-hmm. So even though we're getting vaccines with the variants, now there's that unknown factor, right? Plus, when you add that statistical, that little, maybe 5%, 20%, whichever vaccine you got, right?
Mm-hmm.
So.
Mm-hmm. Yeah, it's and the longer that we don't get this under control, the more variants there will be. This is going to be an annual thing, is because while we're doing a fairly decent job of getting vaccinated here, the entire world isn't. There's countries that haven't done hardly any, and so that is giving the virus an environment to live and mutate, and each mutation makes the vaccinations less effective. So, yeah. But I'm going to Rolling Loud. I don't care what anyone says. I got my 2 shots of Pfizer, and if they have the concert, I'm going to Rolling Loud. I'll wear my mask. I'll still be social distance from people. But
so you're gonna be a Florida COVIDiot, huh?
I'm going to Rolling Loud. I've been in the house for a fucking year.
But that's really part of the problem. People are tired of this shit.
Everybody. So.
Mm-hmm.
But is that a bad move though? If you've got your 2 vaccines and it's been the time and you wear your mask. Is that okay? Can I go to a concert?
You can, but it's just an assumption of risk. That's all.
And a good note for you: you are not one of the high risk factor people because the CDC has reported among people of all ages, but more than 40% are 60 or older, and 65% of such cases have been women. So you're not the target audience for COVID.
For the variant, yeah. Well, here's the big thing is no unexpected patterns have been identified in case demographics or vaccine characteristics. Those are just some statistics, and it's so early, man. They're rolling over 1 million vaccines or doses a day. Biden has far exceeded everyone's expectations.
Yeah.
When he said July, everyone should have it available. Now it's April. In Michigan, everyone 16 and over gets it. And by, I think he said June 1st or May, everyone should have it adult 0 to a death.
They had the National Guard set up a tent here. I took my son to get vaccinated just yesterday. They had the tent set up. They had it was a well-run operation, and then they handed him this card and said, "We'll see you back 2 weeks from now, this date, this time." And so I think they're going to get this thing dealt with. It's just a matter of, are there enough people that are going to do it?
Yeah, it went from a distribution issue to a persuasive issue now. So
that's a huge problem because I think they said 60% of the military is not getting it.
God. Yeah, I saw like the Marines, like 40% of Marines or something said no. They said they weren't going to take it.
They can't make you take that one. They can make you take all the other ones though. I know that for sure. I got 8 of them in a row. I still have patients I have to talk to about the flu vaccine every year. And they're like, I'm not getting the flu vaccine. I get sick every time I get it. As it's got nothing to do with the shot. They're like, yeah, huh? I'm like, I'm telling you right now, would I bullshit you? I'm your healthcare provider. I want to hear what's best for you. I'm telling you, there's no way physically possible that they are giving you anything that actively gives you the flu. It's not the flu. It is pieces of the flu called spike proteins, just like this one. They chop that sucker up and they put it in there in pieces, and your body makes, just like this vaccine, it makes an antibody to the spike protein. You cannot get sick from the flu vaccine, people.
There's a better way of saying that, I think, to people who are, because I think we have to remember, we're trying to tell our population is 72% scientifically literate. So what you just said to them, just they didn't get any of it. Like, and so, like, for example, like one of the biggest misconceptions of vaccine is, why would I get a vaccine that gives me a 95% chance of living if I have like a point, like, it's like 99 point whatever the percent. It's like, because it's actually, they don't even understand what the vaccine does, right? They don't even understand it's preventative, right? It's not once you get it. They don't even understand that basic fact. And we want to explain herd immunity to them, right? And why and this is the problem. 41% of the GOP is not going to get that vaccine.
The vaccine, when you do get it, if you do get it a second time, it is reported to be much milder, much lower death rates. So getting the vaccine still helps you, even if you are reinfected somehow. Even if you do have to go through it a second time, you are still helped by having gotten the vaccine. So get the vaccine.
Yeah. Let's double this back to dumbass Trump. I want to mention him and take a shot of whiskey. But that's when he said, I'm cured. That is the dumbest thing I've ever heard in my life. A vaccine is not a cure. It is preventative treatment.
He wanted to use the flu vaccine against it. Remember, he was yelling at his doctors, like, "Can't you use the vaccine from the flu? Won't that work? Like a little bit?"
Well, like Matt was saying, he's part of that 70%. He is definitely.
No, he knows a lot about science and a lot about technology. He knows a lot.
No one knows more about science than Donald J. Trump. Okay. Jesus Christ, the guy's a fucking moron. I'm so glad I haven't had to mention his name. It's the first time I mentioned his name in a while. It's nice.
You know. He committed a fucking genocide against this country. How about that?
Yeah, 500,000.
And we're going to let him get away with it. And then he led an insurrection against our government.
And we're going to let him get away with it.
And he's not going to fucking have to pay for shit.
Yeah.
We're not just letting him get away with it. We're paying for his office.
Build a library. Twice impeached.
Well, people, it's like wild about this too, is like your public health response is literally tied to your economic like outcome for the most part. That's what's crazy. Is like no one's going to escape it because of like the nature of our economy and like a connected world. But it's like literally the countries that took this shit more seriously, in terms of contact tracing, testing, making sure like their borders were like serious, all this jazz. Of course, like New Zealand, Japan had advantages given island nations, things like that. But the countries who did what they're supposed to and then followed social distancing, masks early on, because people don't want to talk about it either. It's like when you implement mask use and get the proper amount of people within your population is a really important fucking factor in terms of mitigating. Yep. And if it's even 2 months late, and so and then these countries experience way less GDP decline. So
yeah.
There's a great video on. I'll have to drop it in the chat or something, but it models pandemic spread, and it's to those points you just mentioned. They run simulation after simulation of how a virus spreads, and early identification, contact tracing, like quarantine, social distance, that you snuff it out immediately if people just did it.
There's like
we refused.
And then good risk communication, of course. You gotta communicate this message down to the right people within business structures, things like that, so they can then shit.
The worst is right now. We knew these vaccines were coming. The whole game was delaying, like slowing the spread, so to keep people alive, to get them vaccinated.
Yeah.
And they refused to do that and put people so many are dead already. And now that we're approaching where the vaccines are being issued, governors opening up their states and stuff, and like people throwing caution to the wind. It's like these deaths are the most tragic, like that are happening right now. People are getting infected today and dying, and they're like, they thought that they lasted. They thought they made it.
Yep.
We got so exposed by this virus on so many fronts. Like our culture, like as a people, as a collective, because no, actually we don't get that word. As a whatever the fuck this is combination of a bunch of individuals, we got exposed. Like as fuck.
I like that. I really do. We don't get that word. That's a strong
haven't.
statement, but very true regarding the way we've been running things for a while.
Yeah, we're not a collective.
Mm-mm.
No, we're a bunch of selfish
I
assholes.
promise you, we're gonna be. So
We're still tribal.
Well, at this point, it's kind of become a collective or die, right?
100%, exactly. And I don't plan on dying.
All right, guys, let us know what you think about that in the comments section. First of all, wear your fucking mask. It's not that much to ask. What are you, a sissy? Are you scared, you big chickens? Put on your mask, tough guy. Second, get the vaccine. It significantly lowers your risk of dying. Thanks for watching us, guys. While you're here, give us a thumbs up if you like this type of content. If you don't, give us a thumbs down. Let us know why. And fuck you for not liking us. That's the first time I've done that's like this fun. Anyway, so thanks for watching, guys. I'll see you guys next. See you guys next time. And like always, gang fucking gang.